What is up, YouTube? What is up, Canada? Matt McKeever here. And yeah, I didn't think I was going to be here, but it's a Thursday. It's Thursday, right? Yeah, we've got another government announcement coming. Doug Ford's going to be coming to us live from a virtual conference. He's been isolating since one of his staffers, I think, came in contact with someone with COVID, even though he tested negative, and he's had the vaccine. So it'll be interesting to hear what he's got to say. I was just saying before off camera, I'm kind of predicting some really crazy ass shit coming out of his mouth today, but let me know what you guys think is going to come out of Doug's mouth today in the comment section as well. I'd love to hear just how you've been doing. Have you been taking any dangerous walks in the last week? Let us know if you've been a good Canadian and just locked in your house like a prisoner, or whether you've been maybe out and about. And have you seen any other Canucks doing the same? I'd love to hear your thoughts and your opinions. We'll probably dabble on a few things, but before we get into anything else, let me get my screen share up here, because I think you guys know that I've really just got one question for Doug Ford at this point in time, and that is, what are the rules?
What are the rules? Oh, Christ, I'm singing again. What are the rules when you've just turned black and you can't switch back? Well, you gotta go and find out the rules. What are the rules? What are the rules?
What weird times. We're like literally just every Thursday we're waiting around to find out what the rules are. Is it illegal to just be outside? Is it legal to be outside? Can you be on a playground? Oh, playground with mask is cool. What are the rules? This is ridiculous that every week that we're going through this, but hey, if nothing else, this song does make me feel good, so. All right. That's probably good for this second, but sadly, we'll be finding out the rules hopefully at 9:45. But I'd also love to hear who thinks Doug's actually going to show up at 9:45, or is this another giant song and dance so that we can have the Auditor General and scientists and doctors talk to us and lecture us about things that they just really read off of papers that people gave them. I don't know. It's really strange times right now, and again, I'd love for you guys to tell me what your perspective is. And I think it's more important than ever that everyone shares their perspective. And if you legitimately somehow still believe that this is the end of the world as we know it, and that everyone needs to get shots in the arms as fast as possible, and you shouldn't leave your house, and even when you've got a shot in the arm, you should still double mask up, and you should stay 6 feet away from all people at all times, you probably should tell people that. And you know, at the end of the day, we've all got to virtue signal in this crazy freaking world we find ourselves in. But quickly, I'm going to run through a bunch of things that maybe you saw, maybe you didn't. But first, oh, no, that's not the one I wanted. Let me find this here. All right. So did you guys see this clip of Dave Rubin?
Moving forward, police will have the authority to require any individual who is not in a place of residence to first provide their purpose for not being at home and provide their home address. Police will also have the authority to stop a vehicle to inquire about an individual's reason for leaving their residence.
And our inspectors will also be ensuring that those who absolutely must come to work are strictly following the public health measures. For our employers and employees, take note, this is your last warning.
If someone sees their neighbors breaking these new regulations, and having a party.
Remember,
in their yard,
keep calm, don't snitch, get rich.
Should people call police on their neighbors?
If it means saving lives, then I think we have to think about what your social responsibilities are as an individual to make sure that you don't empower other people and invite a whole bunch of individuals to your home.
Let me talk directly to you guys, you Ontario, Canada legislators. You guys are evil Nazi motherfuckers, okay? You understand what we just heard there? You should snitch on people at the end. Police now will be empowered to just pull you over and ask whatever they want. If they see someone not at home, they can basically ask for your papers and what you're doing out on the street. How do you think evil spreads? This is how evil spreads. These are bad, brainwashed people, and there is a disease of the mind spreading across the West.
Legitimately, guys. In fact, I think it's worth listening to that one more time, just because there's so many Canadians right now that are just following along with whatever their government says, because government and hashtag science.
Let me talk directly to you guys, you Ontario, Canada legislators. You guys are evil Nazi motherfuckers, okay? You understand what we just heard there? You should snitch on people at the end. Police now will be empowered to just pull you over and ask whatever they want. If they see someone not at home, they can basically ask for your papers and what you're doing out on the street. How do you think evil spreads? This is how evil spreads. These are bad, brainwashed people.
That's the key. These people are brainwashed. They literally believe the world and the reality they've created for themselves. And yet, you know, we've got the Canadian Pediatric Society talking about the mental health and development and education and social isolation of children. Like, there are real concerns here by real experts and people that are actually boots on the ground seeing this. There are real damages occurring to children because of isolation. And again, Kids Voices Informed Choice recently requested a freedom of information. So they requested all records in the possession, custody, or control of the Ministry of Education pertaining to any risk-benefit analysis completed on decision-making around masking children in schools, specifically with respect to potential harms to children from wearing masks in school during gym class or outside at recess. This should include, but not be limited to, all studies, reviewed reports, reviewed statistics, considered academic papers, presentations, or any other relevant information used by the Ministry of Education in its decision to recommend masking children in schools. The time frame of this request is from March 17th, 2020 through March 18th, 2021. After a thorough search, the ministry has determined there are no records responsive to your request. So they literally have nothing. Like, these are just arbitrary things that this is just people trying to virtue signal and try and win elections and try and position themselves effectively. So again, recently CBC had this come out. Doug Ford's popularity plummets as pandemic takes its toll. And you'll see a lot of news articles now are questioning whether last week's reactionary measures were simply just a way to try and, stop the bleeding of the Ontario Conservative Party. So, next year's provincial election's not looking too good for Doug. And so looking at, Ford's grades on the pandemic were sliding already before the latest developments. In early April, ARI found that just 32% of Ontarians thought he was doing a good job handling the pandemic, down 23% since November. The poll by IRG found that the number of Ontarians with a favorable opinion of Ford fell from 37% before Friday's announcement to 29% after it. His unfavorable rating increased 5 points to 51%. And, this chart pretty much says it all. It's just wild to see how disconnected these politicians are at this point in time. And so kind of continuing on, I thought this was also worth highlighting how information's evolving. So look, and I'll pull out from this tweet, but I believe, actually, no, let's go back for a sec. So this is from December 20th. First image is December 20th. Second image is March 10th. And look how things are evolving. So 86 is good, 55 good, 89 good. And now let's go to the last one. 87 orange, 60 red, 90 red. So literally we've gone up 1% there. We've gone up 1% here, and we've gone up 5% here, but we've gone from greens to orange, red, red. Think about that. Is that really actually going to be accurate, that by going up 1% here with ICU bed occupancy that we've gone from green to red? They're moving the goalposts on this consistently. And again, this is concerning, guys. Like, they make these crazy announcements. Then a few people say, like, no, we won't really enforce it. And then a couple days later, we've literally got checkpoints at provincial borders where you have to show your papers. You have to explain yourself if you're trying to cross the border, because you need to have a valid reason to travel in Canada, apparently, as a Canadian. And this is the sort of mental brainwash shit that Dave Rubin was talking about. Watch this mother literally just spraying Lysol in front of her child as she's walking down the aisle. Now, I literally hope that this turns out to be a prank, or this was someone just like trying to do a stunt thing. But I truly have seen so many commenters on Twitter that live this life, that live that mother's reality of just constant fear and panic. And it should be really concerning. And talking about constant fear and panic, this is a science reporter at the Toronto Star. A science reporter at the Toronto Star that exclusively or entirely covers the coronavirus beat. Look at what she's talking about here. This is about her daughter getting infected at her daycare. We'll never know how she got infected, but I know her daycare friends and staff are the only people she interacts with outside of our household. We never bring her into stores, rarely to playgrounds, and so far my husband and I have both tested negative. What's life like right now? We're double masking 24/7 in the house with a K995 and surgical mask. The windows are open all day to improve ventilation, which means wearing toques and multiple sweaters indoors. Today's snowfall isn't helping. But look at this. We eat our meals separately, sleep in different rooms, disinfect constantly, and hand wash to the point where our skin is cracked and bleeding. I spent a day clearing our unfinished basement of junk boxes and dead millipedes just in case one of us needs to move down there. 8 days into this, our daughter seems okay, and I think we will be too. But the stress of living with COVID in your own home, the threat of infection hanging over your head like a guillotine is hard to convey. I've had a tightness in my chest since last Wednesday. These are the people reporting on this shit. This is the world they live in. And you know what? Originally, I was like, oh, let me go look at Jennifer Yang's Twitter, because maybe this is actually like taken out of context or something. You literally have to get permission to follow her in order to see it, because I'm assuming she's getting crazy-ass backlash from these crazy-ass fucking comments. Like, it's just wild, the world that these people are choosing to live in. And I just want to go to a few things now that are going to be a little bit more conspiracy theorists, but hey, let's just get this out of the way right now. Is Doug doing his thing yet? Or do we know, is he live? I just realized.
News has the live stream up, but it's just on a card saying it will begin shortly.
He hasn't gone live yet, guys. As soon as he does, we'll be ready and we'll jump over to it. So again, Doug Ford, expect to go live at 9:45. He's only a minute late right now, so that's not too bad. But continuing on, if you guys haven't checked out China's social credit system, this is one of the things that you'll hear a lot of people say about these COVID passports and our long-term concerns. I'll leave it to you guys to go dive into this, but a lot of people have shared this, and this is a useful infographic just to familiarize yourself with the slippery slope argument towards the sort of fascism that we could wake up to overnight if we continue just blindly give control of our lives to the government. And so last time, someone got really upset when I talked about vitamin D. I didn't want to just throw out random things because I couldn't remember where I saw that reference. But here's Mike Hart, MD. I'd recommend you guys follow Mike Hart. Really enjoyed a lot of his perspective throughout COVID. You know, somehow other doctors, especially Canadian doctors, still call me a quack for suggesting vitamin D as a treatment for COVID. 14 trials with nearly 1 million patients aren't enough evidence. So a systematic review and meta-analysis, which include 14 studies and about 1 million participants, conclude that low vitamin D was associated with COVID-19 infection, severe presentation, and mortality. Again, like, I don't know who you think's pushing vitamin D. Is it the sun lobby? Is it like Big Sun? Because like I know that there's other things that are being pushed on us, but they actually have legitimate lobbies. I don't think that there's Big Soul out there. Big Sun just isn't a thing. And then finally, for those that really want to go down the conspiracy theorist hole, if you guys didn't see back in the fall, right, there was some emails leaked that had a timeline around things. And while not everything's lined up perfectly, UBI, for example, doesn't seem like it's going to fully get implemented. But at the same time, we essentially have a rolling UBI that's just the CERB or CRB benefits. So again, I'll leave you guys to wander in the dark corners of the internet yourself. But I think it's more important than ever that you get informed. And I guess the last thing is, I'm just wondering what memes we're going to get to make today. We at least got some good memes out of Doug last Thursday, because might as well, I guess, I don't even know. We're making more than just lemonade out of lemons at this point. But keep calm, don't snitch, get rich. Numbers and lines. I actually personally like this one. Let me know if you guys want me to make an NFT of that. I'm kidding mostly. And then finally, something to point at. I imagine he's going to want to have something to point at this time as well. So I wonder whether he's going to get a bigger graph. Maybe he's going to get an 8 by 14 sheet. Maybe we'll get legal paper this time rather than that cheap little 8 by 11 paper stuff. So anyways, I think that I got around to covering just about everything I wanted to do. So we're waiting for Premier Doug Ford to hold his virtual press conference Thursday amid isolation. So again, it sounds like one of his staffers came in contact with someone that had COVID, is what I was reading. And though Doug immediately got tested and tested negative, and he's had the vaccine, he immediately went into isolation. Yeah, and I'm really curious to see what the hell is going to come out of his mouth today. Not gonna lie, guys. But otherwise, if you didn't notice, I got my yellow hat on, which is my Bitcoin hat. So if you weren't paying attention, the federal budget came out earlier this week, and I'm still just kind of perusing it, reading through all of it. But the one common thread, the one common theme I constantly read between the lines is buy Bitcoin, because they're actually not making more than 21 million of it, where when it seems like it comes to these dollars, there's a infinite supply. But don't worry, because modern monetary theory or reasons, just like don't worry about our science behind COVID. We got science.
So Global News updated the article at 9:38 saying it's scheduled for 10 o'clock. But I sent it to you on Facebook if you want to pull it up. It's
all right.
30-second ad that comes up.
We're going to pull this up. Apparently, it's been delayed till 10 a.m. I mean, I'm fully comfortable giving all my power over to governments that can never do a live stream on time, even though literally me and Peter, probably one of us at all times is high. And we're yet able to pull this off at all times. I don't understand, guys, how this is so hard for the government. When we seem to be able to do it. All right, so we're waiting for some live coverage to begin shortly from Global News. Do appreciate Global News. This is the only source that I saw really pushing or promoting this. So assuming that this is true, that there's going to be a conference, I really appreciate Global News. This turns out to be a bait and switch. Well, that would just about be par for the course with our government. So I guess we got a little bit of time. Let's see what's going on in the comments. So what do we got going on here? I'm going to catch up to the top. So Sonny was saying he can remotely attend Parliament and do things. He's scared and is hiding. It definitely seems strange why he needed to immediately just kind of disappear, right? I don't fully get it. And yeah, that's why I'm wondering if we might get some crazy ass announcement today. But again, legit, whatever. Can we just rip the Band-Aid off? Peter and I were talking about this off screen earlier. It would just be nice to rip the Band-Aid off. I don't care which way it rips, like whether it's like, fuck it, we're just going to give them back their freedoms. They're having their temper tantrum. It turns out we're not going to be able to lock them down. Just let them go back to normal life. Or whether they decide, yep, we're going to shoot to kill the moment we see you outside. I would rather just go to one of these extremes right now so I know how to react. This being in the middle, this wishy-washy stuff, this back and forth it's not good for any of us. So that's just my 2 cents, but I appreciate you jumping in there, Sonny. Political opportunity and hard time. Yeah. And again, don't get me wrong, guys. I understand that I'm kind of an opportunist in this situation as well. It's obvious that people enjoy seeing me froth at the mouth and be mad at Doug Ford. And so, I mean, it's not that hard to do. So why not do it? Hopefully it gets us a few more viewers. Maybe you guys stumble into some of our financial independence, our real estate, our retiring early content. And hopefully you can actually get control of your financial lives and start doing something for yourself, because government's not going to do fuck all for you. What else we got here? Complete BS, but people are dying, not because of lack of vaccine, but mismanagement. Yeah, and there's a lot of complicated aspects to this. I think the biggest frustration here is the lack of transparency and information. We absolutely need more information and more transparency. And I've got no doubt that some of the concerns maybe that I have, or that other people that classified as conspiracy theorists have, is simply due to a lack of transparency. Maybe there actually is a good reason every now and then for some of the crazy ass shit they do, but without explicitly really breaking it down for us, without having just beyond a reasonable doubt of information, it's really tough, right? Like when you file a Freedom of Information Act to the Ministry of Education and they have no information, they've never done any analysis on the risk benefit of making kids wear masks or learning, distantly or anything like that. That is crazy in my mind. It's very concerning, and we should all be concerned about their desire to just immediately leap to safety, right? A lot of these politicians are just virtue signaling and just trying to out safety each other. Look, you know what? At least I won't be claimed of not caring. And apparently that's the worst thing ever. But the unintended consequences of this overcaring, people have always died. People will always die. But understand the canceling of serious surgeries right now, right? the canceling of like medical screenings, those will have long-term consequences as well. And like, I can already see how the narrative is going to be written. It just gets my blood boiling more. So I won't even go down that gosh darn rabbit hole. But boy, you should have seen what was going on in my head there for a second. But I'll take a sip of my tea and we'll find another comment to chat about. Future of kids in limbo, specifically high school and university. Yeah, honestly, agree. But I think it's even worse for grade school children. I think that there's some really critical moments. Oh, it looks like maybe we're getting something going on here. But it seems like there are some critical, no, that was a fake. Some critical moments there's always critical moments in the development of children, but I think that the socializing of children is very important, especially at a young age. I think that learning to read and learning to participate and interact with others. And I think that we've seen to a certain degree, in some aspects, a deterioration of social skills amongst children. And I suspect that it's going to end up being a lot worse down the road. But again, we'll see how that all plays out. Is that a different link, Peter? Did I just see something?
I just found another one on CPAC. So that's just in case.
Okay, awesome.
Global news here.
All right. So we've got 2 different streams up that we're watching here, guys. The moment something comes up, we'll be sharing it with you. Meanwhile, if you guys want to share this stream, that would definitely be appreciated. Smash that like button, all that fun stuff. Oh man, this is funny. Just like they've got like their screen and
I know.
How did these guys like, again, there's not a big deal or anything, but it's just funny. Like all of it's just humorous at this point in time that, you know, we're seeing their full screen and stuff like that. I hope accidentally a DM pops up or an instant message or something like, or an email comes in. Doug's still on the can. Give us another 15, whatever it happens to be. But yeah, what a strange time in history.
More legit.
But yeah, I know. So again, anyone that's just kind of confused, Global News gave us an update at 10 a.m. We're expecting that Doug Ford will go live and we'll find out whatever we're going to find out. It's kind of fun, right? Every day is just a treat of like white knuckling to wonder whether, are you in business? Do you have a job? Is the government your employer now forever? Yeah, I don't know. All right. Well, otherwise, I was going to pull up maybe some just Twitter stuff and Bitcoin stuff. So maybe we'll just dive into that for a little bit, seeing how government's going to leave us hanging. I mean, I'm sure they got better things to do than keep us informed of what's going on. So it's just like, yeah, I don't know, guys. What a time to be alive. What are you saying here, Nathan? Matt, you and I are reading all the same Twitter threads. Actually, yeah, I would love to hear what are your sources on Twitter. So again, maybe there's people I'm not following that take a more centrist view. Maybe there's people I'm not following that take a more extreme COVID is the end of the world view. And maybe I need to expose myself to that in regards to it. But yeah, I don't know. And actually, here's maybe a unpopular opinion I'll share with you guys, because every one of these live streams, I like to share some sort of unpopular opinion. If you take a vaccine selfie, it's not impossible, but it's hard for me to imagine a future where we can be friends. I'm just going to say that. Like, again, there probably is a future where we can be BFFs, but I mean, it's going to be interesting because I don't know. I saw someone on Twitter the other day. They had an open dime and they taped it to their arm and they were like, "Mark safe from fiat." I was like, actually, that's a much bigger concern of mine than being marked safe from COVID, especially because being marked safe from fiat is legitimate. 100% efficiency and efficacy in that result versus the COVID vaccine, which at best maybe covers you from 1 or 2 variants, but certainly not the gamut. Daycare is open. No daycare is open. Well, I think this was from a few days ago for anyone questioning about the daycare comment that the Toronto's Star reporter was discussing. Yeah. People who got affected in same house with same HVAC system, it's already proven it spreads by air. I just like the virtue signaling to me in that tweet of talking about cleaning your hands and disinfecting them so much that they're bleeding. Like, what? Why? Like, it just, oh my God, it just drives me wild that that people think that somehow that's like a good thing, that that's something to be proud of. Again, there's nothing wrong with getting the vaccine. If you want to get the vaccine, absolutely, please go get the vaccine. I wish that there were more vaccines available for individuals that want them. But at the same time, don't force vaccines on others. And two, more importantly, the virtue signaling behind it, I think, is really the concern. And understand, this is the entire mental virus that Dave Rubin was talking about, right? So that mental virus is the government and the Ontario Science Table and all the powers that be thinking that you're way too fucking stupid, you mouth breather, you, to be in control of your own safety or your own health. Like, they literally think that they need to do these big songs and dance. Like, this is like the concept of, if they thought that it would convince you guys to social distance, I have no doubt that they would start doing human sacrifices. Like, this is the level of symbolism and rational or like ritual behind what they're doing at this point in time. I was about to reference the book Rational Ritual, but I didn't want to accidentally lump it in with all the stupidity that's going on here. Humans are always capable of stupid shit. But if you want to understand, oh, it sounds like I got some audio coming on. Okay, CPAC's got something going on. Let's get this pulled up.
Here he comes.
So, all right, we got Dougie. Hopefully you guys can hear him.
Well, good morning. My friends, I want to address the events of this past week. Last Friday, in response to extremely troubling modeling that told us we could see well over 15,000 cases a day, we moved fast to put in measures in place to reduce mobility. But we moved too fast. And I know that some of those measures, especially around enforcement, they went too far. Simply put, we got it wrong. We made a mistake. These decisions, they left a lot of people very concerned. In fact, they left a lot of people angry and upset. I know we got it wrong. I know we made a mistake. And for that, I'm sorry and I sincerely apologize. Because as Premier, as I said right from the beginning, the buck stops with me. Again, I'm sorry and I apologize to each and every one of you. I'm sure that you may have noticed that I'm speaking to you today while in isolation. I experienced a workplace exposure from a member of my team who, despite their best efforts, tested positive for COVID-19 earlier this week. And I assure you, it is not lost on me that, unlike many people, I'm able to isolate and continue working. For too many people right now, that's not the case. And during these unprecedented times, regardless of where you work or what you do, if you're forced to go into isolation or quarantine, your job should be safe. That's why Ontario was the first province to introduce legislation to have job protective leave for COVID. But it isn't enough to know you can't lose your job. You also need to know you won't lose your income. And if you're living paycheck to paycheck, you shouldn't have to wait long for the support you need. And for months, my ministers and I have been trying to work with the federal government to fix the existing federal sick pay program. Unfortunately, Monday's federal budget didn't include the important improvements to the Canada Recovery Sickness Benefit that we needed to see. That's why we're now working on our own solution to fill those gaps for everyone in Ontario. Because I want workers to know, as I have right from the beginning, I will always have your back. And I want all of you to know that I will always try to do what's right. And that means if we get something wrong or make a mistake, we'll fix it as soon as we can, like we did this past weekend. But I know that many people continue to be unhappy right now. And I understand that I accept the responsibility for that. Let me be clear. When it comes to protecting lives, protecting our hospitals and our people, we can't waver. But at this stage in the pandemic, over a year into this, going through this terrible third wave, I assure you that there are no easy choices left. I know that these lockdowns, they've been devastating for people. It means telling someone they can't see their family or take a vacation. It means forcing someone to close their business, lose their paycheck. It means telling someone not to properly celebrate a wedding, or sadly, be able to mourn the loss of someone we love. For some, it's been dealing with isolation at home, the struggles with mental health and addiction. For others, it's been going to work, despite the stress of working in a job that puts you and your loved ones at a higher risk of getting COVID. I hear it every day, every single day. People telling me their stories, the stories that could make you cry, families that haven't been able to hold hand. Hold on, folks. I apologize.
You could stop this madness right now. It's completely within your control, Doug. Like, don't pretend like some, oh my God,
Hold a hand
Texas,
with their mom or dad
Florida.
as they passed away because of COVID-19 restrictions in hospitals. Healthcare workers who've been pushed to the absolute limit, working to save lives. I want you to know that I hear you. I understand you're going through. I understand your frustration. This experience, this pandemic, is something that has affected every single person.
Oh shit, Doug just froze. Hey, we're no stranger to that. Sometimes the internet, he's probably on Rogers or something. Can't blame him for that. So let me just see if it's just CPAC or whether Global also is struggling here. Oh, Global still hasn't even covered it yet, unless I'm not fascinating. Oh, yeah, they glitched out here too. All right. Well, interesting. I hope that they double back on this and realize that he's frozen here. So I do feel confident, though. I always like to leave it until at least I've heard part of it. So I feel confident in disliking this video now. However, I would kind of like to hear how it ends. Was he able to cry? Yeah, I assume that that's what all the water was for. He needs to get hydrated before the crocodile tears could really come out in full force. But yeah, I love it. The apology without really changing anything. Like, I don't understand. If science told you you had to do that, did the science change once we all got mad? Is that how science works? Then once people get mad enough, the science and modeling changes? Because again, if there was reason and logic behind this, you could just show us the reason and logic and the science behind this. However, there's nothing. It's smoke and mirrors. It's all just voodoo. It's literally just symbolism. It's just a ritual that they're trying to train you into at this point in time. So I guess while we're waiting for the government to try and get their shit together, I'm going to recommend you guys continue to research and learn more about Bitcoin. So if you haven't read the white paper, it's like, what, 8-9 pages? What's your goddamn excuse? If you've got a little bit more time and a tiny bit of money, go get the Bitcoin Standard or something else similar to that effect. There's also the bullish case for Bitcoin, which is just an online article. If I remember correctly, you can go find. Otherwise, if you guys haven't seen some of the absolutely just amazing Michael Saylor interviews that have been coming up recently, how am I going to find that easy? But yeah, if you guys haven't been checking it out, really encourage it. Hey, there's us. Oh, and also, if you guys haven't checked it out, we've got Matt McKeever Unfiltered now. So it's probably just a matter of time before I lose this channel. So before I lose it, please go sub to the other channel just so that if and when we need to use the second channel, it's there. We do have a couple of little things planned that we'll be teasing out in the future. But let me see if I can find the Bitcoin versus gold debate. And this was just an absolutely amazing moment in Sailor history. So if you guys haven't watched this, you need to go watch the entire video. Probably worth watching twice. And I would say Sailor just destroys the argument for gold, in my opinion. But don't take my word for it. Go watch the entire 2-hour-long video. I'd love to hear your thoughts and opinions. You can always send me a DM on Twitter or Instagram. Those are the two areas you're most likely to get my attention or response. Apologies, they're having technical difficulties, they're saying in the chat. This is the issue from that remote work, Dougie. Sometimes your internet connection's not as good, but yeah, this all makes for just some real fun political theater, right? Like, hey, he was only 15 minutes late, but then he chopped out 10 minutes into the call. So, just like, I don't know.
I love how he's saying too, like, I'm able to work from home, and then
yeah. And again, like all this talk about, I get it, that it's destroying businesses, it's destroying jobs, it's destroying families. No, I don't think you do, because if you really understood how serious this situation was, I think you would be taking it much more seriously. You would be demanding more from your Ontario science table. You'd be demanding more from these doctors and experts, right? You'd be having tough questions and exploring what's going on in states like Texas or Florida. Or you'd be focusing on really getting the right people to isolate and allowing the rest of us to go back. If you guys look at it, and maybe if it turns out this drags on for, here we are.
Okay, we're ready to take questions.
We're ready to take questions.
Okay, your first question comes from Randy Rath with CHCH TV. Randy, if you could just unmute your mic. Oh, try again, Randy.
Hi, Premier.
Hey, Randy.
Hey, thanks for taking my question. You're talking about introducing legislation, I assume, to allow for paid sick days for people. Is this only going to be COVID specific? Like, is it going to end when COVID is no longer a problem, or will paid sick days continue for workers that we now say are essential?
Yeah, no, good question, Randy. What we're doing is we're fixing the gap, we're bridging the gap of the federal government. And, I think everyone has seen myself and our Minister of Labor, Minister of Health out there for months. And we need to work with the program the feds have, but there is a gap about 2 to 3 days that no one gets paid. So we're going to be working on that, and we're going to come up with a very strong program to protect the workers.
Randy, do you have a follow-up? Randy, if you could just unmute.
There, how's that? Can you hear me now?
Yep, I can hear you.
Sorry about that. I'm wondering about going forward with vaccinations. You've had to rethink a lot of things. Are you going to rethink who is eligible for vaccination again? We're talking to childcare workers, daycare workers, and they're saying that they're not in line they're not a priority group, and yet they have to be around little kids who can't wear masks. Those workers and frontline workers in grocery stores and that sort of thing. Are you going to rethink who you're vaccinating?
Yeah, well, Randy, when it comes to the vaccines, I want to thank everyone out there, the person in the mass vaccination centers, the primary care docs, and the pharmacies have done a great job. And we just need to get more vaccines and really focus on our plan. And our plan is to target the hotspots, be it Peel. I'll give you an example. Peel has 152 pharmacies. That's more than anywhere in the country. We're ramping up, and as we hope we're going to get more vaccines in May. We're really going to go hard, which we're going right now. We have mobile units set up for going into companies, targeting companies, both in Peel. There's 13 public health units with 114 hot areas, really hot areas. So that's where we're going to focus on the vaccines, and we're going to continue. Everyone across the province gets some, but we're going to really focus on those areas.
Your next question comes from Colin DeMello with CTV News. Colin, if you could just unmute your mic.
Hi, good morning, Premier. You can hear me?
Colin.
Perfect.
Yeah,
Hello. Premier, you say the buck stops with you, but I think people across this province are wondering, what does that actually mean? Columnists have recently said there is no effective leadership at Queen's Park. Another one said you are showing raging ineptitude. And some are calling for your resignation. Premier, do you still have the moral authority to lead this province as Premier?
Well, columnists and media, they have the right to voice their opinion. I can tell you our team is strong, our team is united. I'm so grateful to have the best caucus and cabinet that a premier's ever had. We have the most diverse group of people I've ever seen, smartest group of people, and we're going to continue to lead and get through this pandemic. And once we get through this pandemic, we'll turn the economy on like we have in the past. But I'm not one to walk away from anything. You know, we're going to continue to lead throughout this pandemic as we have right from the get-go, Colin. Not long ago, before the whole world saw the third wave, we led North America with the lowest cases per 100,000 for any region our size. You know, we were the first to close down schools, first to put people in lockdown. As much as I hate doing it, we were the first in so many different areas. We were the first to protect people's jobs. We went out and we made sure we took care of companies, giving them a $20,000 grant, up to a $20,000 grant, and then we doubled that for another 20,000. So there's a lot of things, you know, that are moving in the right direction. We see with the vaccines, and let me add the limited amount of vaccines, we're dealing with the cards we've dealt with to get us through this. Once, and the team out there, everyone, thousands of people have shown when we have vaccines, we'll get them into people's arms. We had a record-breaking week this week, close to 130,000 yesterday, 130,000 or 131,000 the day before. I'm going more than 18 hours a day, every day, 7 days a week. I'm not going to stop.
Follow up, Colin?
Okay, thank you, Premier. You recently said at a news conference that you do not mislead the public. The NDP, though, says that you actually let us off the cliff. They say we are now in free fall, and they say that you have blood on your hands. Premier, why should people trust you to lead us out of the third wave when your government is responsible for bringing us into the third wave and all of the death, destruction, and devastation that has come along with it?
Well, I'm going to totally, you know, sincerely disagree with that last comment, Colin. And first of all, when it comes to the NDP and Andrea Horwath, she has the right to say that. Del Duca has the right to say whatever they want to say. All I know is I've been at this job 24/7, literally, every single day. I haven't missed a day, haven't taken a break. And you know something, to say that I'm the reason there's a third wave around the world, because it is around the world, to say that I'm responsible for not securing our borders that brought this variance and caused the third wave, to say that I'm responsible for not having enough vaccines, that we wouldn't be in this position if we had tightened our borders, if we had ample vaccines like countries around the world. You know, Colin, we wouldn't be in this position right now. But we're going to do everything we can. We're going to move forward. And the results of our actions and the impacts of our actions, I think people will see over the next couple of weeks. And I hope to God that we're right.
Your next question comes from Laura Stone with the Globe and Mail. Laura, if you can unmute your mic.
Hi, Premier. Can you hear me?
Yes, I can, Laura.
I'm wondering if you can tell Ontarians what exactly you're sorry for. You talked about off the top, essentially instituting province-wide carding, which all the police forces came out immediately against. Is that what you're sorry for? Are you sorry for closing playgrounds? Are you sorry for not limiting essential businesses?
Yes, thank you.
As scientific advisors
At least, like,
called
let's
for?
have
Are you
some
sorry for
goddamn
not instituting
specifics.
paid sick leave for the past year? What exactly are you sorry for, and what are you going to do about it?
Well, I think once we saw the modeling of 15,000 people, mortalities they said would be going skyrocketing. Yeah, that puts a scare in you. We saw that the mobility of people, they were moving. We saw it on the cell phone. You know, when
These people think they've got the right to do things.
Moving all over the place. This is all about mobility. And what reason I'm sorry we acted too quick on the measures. All I hear is limit mobility, and we move too quick. But anytime, you know, if I make a mistake, I correct it immediately, which we did on the weekend. And again, when it comes to playgrounds, you know, the people were telling me limit the mobility. And we corrected that.
So what changed though? What changed in your science?
The parks have always been open. Each public health unit, they if they want to lock down the parks, or if they want to, you know, close things, that's their choice. But I think we've done the right decision. And again, the reason I'm here and I'm apologizing, because we moved too quick with having people
and too quick, as in, like, this stuff, we're coming back to this eventually, right?
Tell the people of Ontario, I've never ever directed the police. I never have, I never will. The police have the discretion in their powers.
Follow up, Laura?
Premier, I think a lot of the scientific advisors, including the science table, would quibble with your characterization that you moved too fast. I mean, you didn't do anything on essential business. You have not done anything on sick pay, and I know you say that you're going to. And your government has closed all outdoor recreational facilities. I mean, it just seems like everything you guys did on Friday
doesn't
was
actually
the
get
opposite of what the advisors were calling for. So how can you say that you moved too fast, and are you going to reverse or change some of those other recommendations that most of the medical community is calling for?
Again, Laura, the modeling was showing that the numbers were going up to 15,000, and thank God they haven't, because of the actions that we've taken in the past. Laura, I want to remind you and everyone, we have this strict restrictions in all of North America. You know, we've had Peel and Toronto basically in lockdown since September, and we took action. We moved quickly on the schools. We locked down the schools. We made sure we put the stay-at-home order in right away. This is all about mobility. This is not about telling people, you know, you can't go walk in the park or take a jog or ride on the bike. Over and over and over again, every doctor I talk to, and I talk to endless doctors.
Let's see a list of these doctors.
You know, say limit the mobility, get your exercise.
I'll talk to a lot of people, guys. Trust me.
We need to stay at home.
You couldn't trust me last week, but this time you can definitely trust me.
In some areas around the world, are taking a lot stricter restrictions. I've never been a believer in curfews, like you see in Quebec, telling people they can't leave their house permanently. Some docs were saying, you know, do the Australian measures. I don't.
Some governments get to even be more repressive and tyrannical, and like, you guys aren't even letting me implement martial law.
Right here in Ontario. But I can also tell you that I have different views from many different doctors. When I talk to the doctors, I tell them, you know, kind of jokingly, I'll talk to 10 doctors and get 11 different answers. you know, and they're the best. So they all have their opinions, and I listen to Dr. Williams and other docs and CEOs of hospitals.
Your next question comes from Holly Mackenzie Sutter with the Canadian Press. Holly, if you could just unmute your mic. Hi, Premier. Just wondering if you can could you give us a firm date of when we're going to see the details of the sick leave program and how soon people can access it?
Well, we're working on that right now, and we'll be rolling that out. But what I can tell you, it's going to be one of the best in conjunction with the federal government in entire North America. I also want to remind the people of Ontario, there's no other province in this entire country that have the program that we're going to be laying out. Nowhere close.
Follow up, Holly? Yeah, I mean, we know that you've resisted introducing a provincial program like this for months, and many experts might argue this delay actually contributed to how bad the third wave is right now. So can you just explain to us why you waited months to develop this program, and if you have anything to say today to people who contracted COVID through the workplace over the last several months of the pandemic?
Well, Holly, as I said earlier, we've worked months publicly coming out. Again, our Minister of Labor, the Minister of Health, myself come out numerous times. There's $700 million that have been sitting there from the federal government since September. And the system was broken. They made a quick little fix, but it wasn't there. And we kept asking to tweak the changes. And when the budget came out, there wasn't any changes. And so we're going to take actions ourselves, and we will have the best program anywhere in North America, bar none.
Your next question comes from Travis Danraj with Global News. Travis, if you can unmute your mic.
Hey, Premier. I am sorry to see that you are at home self-isolating. I hope you're feeling well and you continue to. This is the first time I have seen you this emotional in a very long time. And I'm just wondering about that, what the reason is, and also unpaid sick days. I mean, we were talking about this last week, if you remember. The previous government brought in a paid sick day program to match what they had in Quebec. One of the first things that your government did is kill that program. You're at home right now. You have the luxury to do that. You're making $800 a day or around there. And these folks don't qualify for anything more than $450 a day. I know that you are going to do something now, but do you regret the decision to cut that program initially?
Oh, Travis, first of all, I answer your first question. I apologize to the people for getting emotional. The responsibility is huge on someone's shoulders. And you're going 18 hours a day around the clock, and I know we have the best team ever. I know we have the best docs. Everyone's trying. Yeah, does it hit you sometimes? Yeah, it hits you sometimes, and I apologize for that. But as for the federal program, we worked hard to the existing program, and I'm going to give credit where credit's due. It's Premier Horgan in that aspect that led the charge out in BC, and the other premiers followed. BC, they do a great job, but again, all the provinces aren't going to have a program that we have. We were hoping that we could work with the feds to fill that bridge, to fill that gap when someone gets tested and they don't get paid for 2 or 3 days. We're gonna fix that program. I don't believe on putting the burden on the backs of businesses throughout this pandemic that are struggling. I just don't believe in hurting the businesses more than they've already been hurt. So we'll come up with this program, and again, it will be the best program. And
more programs won't fix this.
Working on solutions as we talk right now.
Government make problem, government make program, government make problem, government make program.
I do, thank you. I just want to follow up on something Laura Stone asked and also Colin. Yep. I know that, Premier, you say that the government is not responsible for the third wave and what has happened, but the science table, the province's own science table, provided clear evidence since February. And in fact, Dr. Brown said in February that we were walking towards a crisis. So how is the government not responsible when very clearly they ignored what the experts were saying for a very long time?
Yeah. Well, let me go back to what I said earlier, Travis, that, you know, right from the get-go, we've taken all the measures that, again, Dr. Williams, other doctors, I had a good conversation, Dr. Brown, that's part of the science table. I had a good conversation with him. We've taken extreme measures, extreme. And I'll quote one of those doctors that said, if we didn't take those measures that we did, we'd be seeing 15,000 cases a day. We'd be seeing mortalities go up at a rapid pace. We've taken some pretty strong measures. Again, the strongest measures in all of North America. We've seen cases, outbreaks, be it in Quebec or BC, obviously here in Ontario. We've seen them all throughout the United States. We've acted quickly. Again, no matter if it's the schools doing rapid testing, millions and millions of rapid tests. We're still testing for COVID, the highest numbers in North America per capita than anyone. We've closed down our schools. We've put payments to support families with their kids and families right across the board, along with businesses too. And that's a fraction of what I'm telling you. We're going to continue moving forward. And, you know, people are frustrated now. I understand. But what I can tell the people of Ontario, we're going to get through this. You know, we get more vaccines. By the end of May, if we get the right amount of vaccines, we'll have every person in Ontario with their first shot. Those are staggering numbers. By the end of this month, with the limited supply of vaccines we've had, we're going to hit 40% of the population. And we're going to continue to build on that as we get more vaccines. We're going to continue to ramp up the pharmacies. We have 24/7 pharmacies going now, over 20 of them, and we're going to continue to ramp that up as well.
Thanks, everyone.
Okay, thank you, everyone. Stay safe. Thank you.
All right. Well, that happened. I'm just going to see how long CPAC continues to share their screen, but otherwise, so it obviously we didn't get to see the full announcement, but it seems like they announced they're going to top up the federal sick day program, trying to make it easier for people that are getting tested or whatever to be able to continue to get paid. These are all like, I get it. Like, I understand that there's a lot of confusion out there because there's so many different sources of random things. But I saw someone ask what my opinion was on what should be done or what could be done or how to approach it. Again, I'm not perfect. I'm not saying I'm perfect. But when given the decision between, you know, overly being safety oriented or allowing people to continue to be humans, I'm going to lean towards allowing them to be humans. So I don't know, programs like allowing people to isolate that are vulnerable, right? Encouraging those that are symptomatic to stay home and isolate. And, you know, if you want, roll out some sort of sick day program around that really allows individuals to do that. Trying to get as many vaccines out there to the individuals that wish to get vaccines. But understanding that I literally believe that years from now, and some of the stuff you might have to read between the lines on here, but I believe years from now, there's going to be stories leaked or come out that are going to reflect that the bigger a deal you make out of COVID, the bigger it became. And now what I mean is when people think that it's the end of the world, they go get tested more often. And there's a greater chance that you may end up having it or you may not have it. But like, there's literally a lot of behavior that's actually doing the opposite of what the government would like. And so I think that one of the reasons that we see places like Texas and Florida succeeding so well, and again, like Florida's had a great rollout of the vaccine and so on, but still, I believe the big aspect is not making it the end of the world. Because you know what happens? Like a lot of the people that probably go in to get tested are like very healthy, probably very unlikely to have a severe adverse effect due to a COVID infection, particularly if you're young, if you're healthy, if you're not any pre-existing medical conditions that make your immune system weak, all those factors. But in places like New York or Ontario or Quebec, where they make it the end of the world, I literally think people can help make themselves sicker, right? Like you can literally play games with yourself mentally and force yourself into being sicker than you otherwise would be. And I'm probably not being nuanced enough here. And so people are going to be like, Matt thinks COVID's all made up. No, absolutely not. But the same way that literally if you decide when you've got that cold, when you've got the flu, when you've got COVID-19, or even when you've got something like cancer, if you get into a really negative mind headspace, you can easily compound the issues there, right? Again, some of this is in your head and some of it's then in your head and then comes through your actions and habits, right? If you think it's the end of the world, if you think that like things will never be the same, if you think that all your family's going to die because of COVID, I think it's easier to turn to things like junk food, right? For comfort. I think it's easier to turn to things like substances for comfort. I think it's easier to turn to bad habits. I think it's easier to break your exercise routine. I think it's easier to essentially give up on a lot of the good things that will actually protect you from COVID-19, like going for walks or getting sun or doing any of the other things that we've talked about on this channel in the past. And so this is the real issue here, right? Is when you make this into being the end of the world, people treat it like it's the end of the world and they react differently under those circumstances than they do when the world is normal. And I think that that's one of the biggest issues. So what I would say is like, again, vaccines for everyone that wants them. And definitely, I think with hindsight, we're going to look back that some of the stretching vaccine doses and stuff isn't going to look good on the Canadian government, but time will tell. Secondly, allowing those that are susceptible, that those that maybe do have pre-existing medical conditions, that are overweight, that have respiratory diseases pre-existing, all that stuff, then yeah, figure out some sort of system, some sort of program, some sort of ability to really help those individuals continue to isolate until they're able to get the vaccine or until it seems like things are normalized or until ICUs even drop lower. But again, this all stems to a bigger discussion. The medical system wasn't perfect pre-COVID, and the medical system isn't perfect during COVID. It was already at max capacity. And what we're doing here now isn't solving the problem. We should have been pouring so much more money into actually making plans and preparing for all this. Like we've set up so many temporary field hospitals and yet never had a use or need for them. And yet there's other things like, I'm not even going to say it right. Is it Invectum or whatever? A few of the doctors I follow are really pushing to allow this to become over the counter so that individuals can actually help treat themselves more. Where it seems like in the Canadian hospitals, there's a fear of using it in case we run out of it. And like, I think that again, there's some circular logic there where we're not going to give you stuff that maybe will help you because what if we need it later? Well, why don't we just use it right now? Like, again, that's an oversimplification of everything, but this is concerning. You guys should be concerned. And you absolutely need to be making sure you're putting on your financial life jacket yourself because the government is not going to take care of you. I don't care how many paid sick days they offer. I don't care how big of a UBI program they roll out. I don't care if they offer to pay every Canadian $1 million. We don't live in a vacuum. And so because of that, any sort of stimulus they inject into the economy will have consequences, and some of those will be unintended consequences. And inflation is here. I don't know what else to tell you. It's absolutely here. If you're not protecting yourself, you're being willingly blind and naive at this point in time. And so whatever asset class you decide to flee your fiat from, you should probably be seriously considering that at this point in time. Now, again, that doesn't mean that you just jump into anything unresearched. Don't blindly jump into Bitcoin because I talk about it. Don't blindly jump into a random stock because another YouTuber talks about it. Do your own due diligence. Make sure that you've actually got a financial plan and that whatever investments, whatever assets you're accumulating fall in alignment with that plan. The only way to have an effective plan is to really understand your why. If you haven't got down to your why and really understanding why you're here, what you're trying to accomplish in this world, then you absolutely should go check out like my free ebook that's discovering your, I don't even know what we called it, but anyways, there's a free ebook. You'll find the links in my Instagram and Linktree and all those places, but go discover your why, really explore and understand yourself and your motivations, and then build a plan that's going to allow you to accomplish that. Because again, you know, frothing at the mouth and getting upset about Doug Ford maybe gets me an extra few views, but it's honestly not helping you guys get control of your lives, right? What you need to do is get control of your lives. Focus on what, like, exercise, go outside, see your loved ones, Be normal human beings. Don't listen and buy into just all the bullshit. Again, don't even buy into my bullshit. Go do your own research. But what's important is that you don't just automatically default to fear. And that's really what I see when I listen to a lot of politicians, when I see a lot of these talking doctors and talking heads. So much of it is just a desire to sell fear. They're in the fear business. And they both sell it and then sell the solution to that fear. They create the problem and then they try and solve it with a new program. This is just government. And it's not even that government's some massive organization of evil people. It's just every organism. Every organism tries to expand and gain more control, more resources. That's just how life works. And so again, to expect a government organism to act any differently than essentially any other organism feels really naive to me. And so that's why it's so important that you guys speak out, that we create common knowledge as game theory would dictate, because if not, we're eventually all going to become Winston Smith from 1984, where it's going to be too late for us to speak out. There's going to be no one else to create common knowledge with. There won't be a brotherhood to fight Big Brother. And I know that some people think that tinfoil hat match or whatever, but I don't care. Give it 5 years, give it 10 years, give it 20 years, you'll see. And so the one thing that regardless of whether I'm right or I'm wrong, that I believe that you should do is get control of your financial life. How could you regret that? Just under what circumstances would you regret that? So go out there, get control. If you're interested in learning more about Bitcoin, again, go read the white paper, read the Bitcoin Standard, read the bullish case for Bitcoin. Go check out some of these awesome videos with Michael Saylor that I'll pull up again here just to share with you guys. So again, like this was an epic video just discussing gold versus Bitcoin. And it's much more than that. So again, if you're looking for a reason just to get bullish on Bitcoin, really encourage you guys to check that out. Otherwise, let's just go back and visit Dave Rubin one more time to remind us how crazy our government actually is, because it's important that we create this common knowledge and understand these people are not good people.
Let me talk directly to you guys, you Ontario, Canada legislators. You guys are evil Nazi motherfuckers, okay? You understand what we just heard there? You should snitch on people at the end. Police now will be empowered to just pull you over and ask whatever they want. If they see someone not at home, they can basically ask for your papers and what you're doing out on the street. How do you think evil spreads? This is how evil spreads. These are bad, brainwashed people, and there is a disease of the mind spreading across the West.
Yep, 100% agree with you, Dave. It is an absolutely ridiculous set of circumstances we find ourselves in, where everyone has gone off the reservation, it seems like, and it's hard to ever know what are the rules. So I'm going to leave this with you guys because it at least leaves me on a positive note. So I hope it leads you guys with a positive note as well, because frothing at the mouth doesn't really get us anywhere, but get control of your financial lives. If you guys want to check out, there's probably a Shakepay link in the video description down below. If you decide to buy some Bitcoin on Shakepay, I get $10, you get $10, but I don't care where you actually buy your Bitcoin. But I would love to see you research it. And then if you decide it's right for you, maybe get into it 5%, maybe even go crazy and do 10% of your net worth. Or if you're one of those permanent portfolio people, go watch the gold debate on Bitcoin, and then maybe you're going to allocate 20 or 25% of your net worth to it. But what are the rules?
What are the rules? What are the rules? When you've kept your brain, but the world's insane, how the hell you gonna find out the rules? What are the rules? Of being black in America. What are the rules? Of sleeping from your body. What are the rules? Who could say the N-word? What are the rules? I really want to say the N-word. What are the rules? What are the rules?
All right. Thanks, guys. Go be dangerous. Go for a walk or do something else insane. And we'll see you on the next, probably next Thursday or whenever the government decides to update us on what the rules are. Appreciate you, and get control of your financial lives.